on the battlefield. Well, when that happens, they have to decide. One of the nice things that happens is the doctors will go out and say, we have to save everyone, Confederate or Union soldiers. So the doctors do not have a choice who they save, even depending on what side they were on. So we're going to talk a little bit about how you amputate someone and how this was done during the Civil War and how you do it now. Okay? If, this is my disclaimer, you get squeamish, you're welcome to leave at any time. I'm dead serious. Okay? There's going to be some pictures that are kind of graphic. Feel free to leave. Don't worry, I'm just making this.
Wait, hold on.
Oh my God. It's my first, you're right, first people I've ever done this to. You are the guinea pigs. Are you so excited? Okay, click it. Alright, Walt Whitman, a famous poet, once said, the real war will never get in the books. It's the hospital part. It's the part they never talk about. We're going to talk about it right now. So the hospitals, the first MASH unit we have, you've heard from MASH, the show, the old show. It's a mobile hospital. And their job was to go out, into the field and collect the bodies afterward and bring them back. Alright? So this is the system of excavating the wounded from the battlefield, and this is the first time it's ever established. Before they just left the people to die there, buried them there. But now they have the system, started in the Civil War, where they go out, bring the people to a hospital, and that's your hospital. Merely a tent. Okay? So nursing was elevated to the biggest thing. It's one of the biggest jobs women can do now during the Civil War. Here's one of the hospital scenes waiting to get to the waiting room, per se, to get in, to see the surgeon. Go ahead, click it. You see some other people just waiting there. Sometimes the surgeries were done outside, which can be a little unsanitary. Go click it there. And here's a bunch of people just waiting to get inside the main tent to see the doctor. Okay? So unfortunately, this was a few years before we discovered germs. And I'm sure you guys have heard of Pastor, have you heard him before in science, biology, right? He discovers that germs are everywhere. So I would perform this as a doctor with no gloves. No nothing. I wouldn't wash anything down. I wouldn't use any alcohol. I would do a surgery, move to the next guy, do a surgery. What might that do? You're going to spread a lot of diseases, right? We actually see the biggest spreading of the AIDS disease during this time because of that. Okay? We see things like this popping up all the time, right? So doctors dug out bullet fragments with their bare hands. No utensils will be bloody like you see here, and then reused. Okay? We're going to talk about that a little more. Go ahead and click it. Okay, at the battle's end, no matter what, we talked about this already, doctors were left behind to help everyone. So regardless of what side you were on, the Union or the Confederate, as a doctor, you had to support and free everyone, which is kind of a nice thing to do, right? So it says, history teaches us that the wounded and the prostrate foe is not then our enemy. So they say, even though they're wounded and they're down, that's not our enemy. Go ahead and click it. Okay. This is an amputation here from the Civil War, and this is what the definition of amputation is, okay? The removal of a body extremity by trauma or surgery, and it's the Latin word to cut away. And that's what we'll be doing today, if all goes as planned. Why you amputate? These are a few reasons why you might amputate someone. One of the reasons is a war injury, which we're going to be talking about today, but these are some of the other reasons you might amputate someone, okay? To prevent spreading of an infection. Our Confederate soldier has an infection, we need to operate immediately, okay? Form of punishment in some countries. This was seen as a form of punishment in early wars for other countries, to amputate parts of bodies as a sign of punishment. Used to control pain in the infected area, act of terrorism or tactic of war is also used, and removal of deformities. Okay, go ahead and click it again. This is how you would prepare for surgery. So let's prepare. Okay.